It's a very common problem that people struggle with tightness all up in their lower back muscles, especially when they're training. So I'm going to go through why that might be, and I'm going to tell you exactly what to do about it. Now, the first thing is, usually it's not the actual lower back muscles here that are tight. Usually it's the glute muscles. Okay, it's actually the top of your glutes. So up here, if you put your thumb here and here, just like at the very base of your spine, the top of your bum, and you feel the tension is here, then likely it's your glute medius, not actually your lower back muscle, your lower back muscles. But if it is your lower back muscles, this is going to help as well, and we're going to go through a couple of things that you can try to identify the problem, okay? So let's go through the glute medius first. Now these muscles here, they help to stabilize your hips when you're standing on one leg, okay? So if you stand on one leg, your hips go to the side like this, but the glute medius activates to straighten your hips up, okay? So that's the function of that muscle, basically, okay? So there's a couple of things you can try to do, and after you do these, you should be able to tell whether this is the actual problem for you or whether it's something else that we're going to go through as well, okay? So the first thing we're going to do, we're going to go over to the wall. We're going to try and use the muscle for, 20, 30 reps or so, just to get some blood in the area, get it warmed up, get it loosened up, and then I'm going to show you some mobilization exercises you can do, okay? So stand up against the wall. This arm here is literally just for a bit of balance, okay? A bit of support and a bit of balance. And what you're going to do is lift the leg up as closest to the wall, okay? And then what's going to happen is your hips are going to slump out this way, and then to activate this part of your butt, you need to push your bum towards the wall, okay? So you can stand a bit closer and a bit far away. So from here, your hips are going to come out to the side. So push your fingers here, put your thumb there, and feel that muscle contract as you push your hips towards the wall, okay? You should feel it in there. Squeezing it. Stand up nice and tall, don't arch your lower back, like this, okay, keep it straight, stand up nice and tall, lift the leg up close to the wall, and then push your hips into the wall, and then back. Push your hips into the wall, and then back. Nice, slow and controlled, standing up nice and tall, do about 20 or 30 reps, okay, get to the point where you can feel it there, you can feel it burning a little bit. If your hip flexors are tight and your quads tight, you might feel it burning a little bit here as well, so just drop your knee a little bit if that's really tight. Really focus on here, okay? Pushing into the wall. It's fine if there builds up a little bit of tension, a little bit of burning as well, but make sure you feel it in the side of your hip, in your butt cheek there. Okay, so about 20, 30 reps, do it on each side, and then you're gonna come to the floor, and you're gonna do this little kind of like mobilization, stretch slash kind of like tissue release, okay? So you're gonna put your thumb into that part of your glute here, okay, and then you're going to push your knee down towards the floor here, and then push your leg back and up with your toe pointing towards the floor, okay? So I'll move back a bit so you can see. So from here, you push your thumb into the area that's tight, okay? You may need to do it a few times and keep moving your thumb around until you find a nice tight area. And then from here, push your knee down to the floor, then push your heel up and toe pointing down. Make sure your leg's not here, okay? It goes right back. Needs to come right back, so you feel a really good contraction here. You come down, touch your knee on the floor, back up, squeeze there, keep your hips pointed down towards the floor a little bit. Do about 10 reps there, really digging your thumb in, okay? And then once you've done 10 reps, just pause at the top and hold it there. Squeezing your thumb in nice and tight, okay? Find a tight area, squeeze your thumb in, pause for about a minute if you can do it, okay? You want to get it to burn as much as possible there, okay? After you've done that, stand up, and you should feel like it's alleviated a little bit. If you do feel like all that's alleviated, the tension in your lower back, then that's the main issue for you. Okay, I would do that every day, maybe even multiple times a day. You go against the wall, do that, boom, and then do that on the floor, and that should help to alleviate the tension. Okay. Another thing to try, and which is often a cause of your lower back pain, is tight hip flexors. Okay. The muscles here that flex your hips, these get all jacked up and tight. And when these are tight, it causes the lower back like this. Okay, it's usually from a lot of sitting, yeah? You can imagine if these get tight, it kind of does this, and then all these get tight, okay? So usually it goes hand in hand, the tight lower back muscles go hand in hand with tight hip flexors. So with this one of my favorite things to do is just to go into a lunge, okay? And then bring your back knee down and just hold it halfway, a big stretch up. If you can't go all the way down, just come up a little bit. The further this leg is back, the more of a stretch you're gonna get. Okay, so if it's too intense, just bring it in a little bit. Okay? And if you can't go all the way down, don't worry. okay? Just stick with it. As long as you feel a burn and a stretch, that's the main thing, okay? Don't worry about if it looks perfect and you're getting all the way down. Just focus on a burn and a stretch, okay? That's what we're looking for. We're looking to fatigue those muscles. We're looking to stretch them, but work them at the same time. So we're strengthening them and stretching them. And basically, when you're isometrically contracting them like that in a stretch position, you're starving them of oxygen. Yes, all the waste products are building up. That's what the burning sensation is. Okay? So, and what that does is causes then an adaptation. Then your muscle tissue will basically be damaged microscopically, and then you'll heal there if you're sleeping well and your nutrition is right. You're going to be recovering, and it's going to grow back the tissue. You're going to grow stronger muscles. There's going to be more, you even grow capillaries, so the blood flow to that area increases. Okay? So this is all, you've got to just trust that all this is going to happen down the line. You know, you've got to kind of like suffer now a little bit, put the work in, do what is necessary, recover, rest, and then your body starts to adapt, and you just need to be consistent with it. Okay? It's going to take a bit of time, a bit of work, all right? So down here like this, you can stretch up like this to feel a little bit more of a stretch. If you need more of a stretch, step forward more, drop your hips right down, and just pause there. And take some deep breath. Okay, you can lean to the side, lean back a little bit. Big stretch in the hip flexor. Okay? If that's too intense and you can't do it even up here, then you can put your knee on the floor, okay? But ideally, you want your knee off a little bit so the muscles are working harder. Okay, so that's something you can try. Do a minute on each side about 3 times, okay? Once you've done that, if you feel like, oh, that's alleviated the pain in my lower back and the tension in my lower back, then obviously that is one of the key contributors to your lower back being tight, okay? So that's the second thing to try. The third thing to try is your hamstrings, okay? Hamstrings, when these get tight, and obviously it's all tied into like your glute muscles, when these get tight, they can be a problem as well. But we're first going to talk about your hamstrings. So, one of the main things I like to do for hamstrings, especially if the issue is the lower back pain, is to basically, we're going to do like an active kind of stretch, okay? So you're going to grab, almost like you're going to do a quad stretch, you're grabbing one foot, and the beauty of this as well is that it works on that glute medius muscle at the same time. So you're going to grab one foot like this, okay? And then you're going to make sure your hips are stabilised, so don't slump over to this side, straighten your hips up, and then you're just going to slowly lean forward until you feel a stretch in the back of your thigh, and then come back up, but not all the way. You're trying to keep a bit of tension in that hamstring the whole time, keeping your hips stable. If you need to grab onto a wall or something, use that for balance, that's fine. Just make sure your hip doesn't slump this side. Get it in this side so your glute medius is working, and then you come forward till you feel a stretch in the back of your thigh. Straight to the side. Okay? So you're down like this. You can bend your knee a little bit, not too much though. You're trying to get a big stretch here. I'm losing my balance a bit as you come down. Big stretch here, back up, back down, back up, back down, okay? Do about 20, 30 reps on each side. Do that about 3 times, okay? Then obviously you can just do a hamstring stretch. You can put your foot up on a box or something, reach towards your toe, okay, and hold it there for about a minute on each side. If you give them a little bit of a workout, get them firing, get them burning, get them loosened up, do a bit of a stretch on them, you know, stretch for longer than you want to. Make sure it opens it up a little bit. If you do that, and then you find that alleviates the tension in your lower back, then obviously that is one of the key problems when it comes to your lower back pain. Last thing I want to go through with you real quick is your glutes. So a lot of people struggle to activate their glutes when they're doing certain exercises. Often the lower back jumps in all the time. And sometimes it can be because the glutes are really tight and they're just in a constant state of being contracted, basically. So you struggle to really engage them because they're already kind of engaged, you know? So you lose the connection with them and the lower back jumps in all the time. Excuse me. So what I want you to do is do some exercises which you can really feel a connection with your glutes, okay? To prime the glutes, to fatigue the glutes a little bit as well, so that it helps to loosen them a little bit, okay? So this is one of the best exercises that I like using. You can just use like an edge of a bed or something to hang your hips off, and all you're gonna do is hang your hips off, and then you're just gonna raise your legs up, squeeze your butt cheeks, pause for a few seconds, come back down. Okay, you can play around with your legs straight, maybe try bending your knees. Okay, you can even put a weight in between your feet if you wanna, as you progress with this. Okay, but this really helps to activate your glutes, and as I said, if they are really tight, doing this frequently and doing it to the point where they burn and fatigue, it helps to then actually loosen them up and relax them a little bit, because you're pushing them to the point where they literally can't do any more, and then they're forced to relax and alleviate their tension there, okay? So doing some of these, do reps throughout the day, especially if you find that this is a particular issue for you, contracting your glutes and getting a good mind-muscle connection with your glutes. Do this every single day. okay? Just do like 5 sets of 10 reps, okay? And do that every single day, and then progress with time and maybe even add weight, okay? That's what you can do to like get loads of blood in there and contract the muscle and get it burning. And then obviously you can just do a stretch. You can lay on the floor, you can grab your knee, pull it into your chest, hold it there, okay? Take some deep breaths, and then try maybe moving it out to your armpit as well. You may feel it more on the inside of your hips. And hold it for a minute, maybe 2. Hold it for as long as you need to for you to feel like you've alleviated it a little bit. So you've basically just got to look at all the muscles surrounding the area, and you've got to figure out which ones are loose, which ones are tight. Yeah, which ones do you struggle to activate? Which ones do you struggle to really connect with and consciously contract? Which ones have a really short range of motion, you feel like you can't, they're super tight, you can barely move without them really cramping up. Those are the muscles you need to work on developing, strengthening, and I would do loads of reps with just body weight, simple exercises, but do them every single day, okay? And if you do that, you identify which muscles are tight for you, which ones are weak, you work on them every single day. Within a couple of weeks, you should notice a benefit from it, okay? You need to make sure your stress levels are low, you're sleeping well, okay, getting loads of sleep in, as well as doing, other simple body weight exercises like squats and lunges and all that sort of stuff. And then also working on your spine and your upper body mobility. That's a whole different video though, okay? So give that stuff a go. Let me know if it's worked for you. If you come to the gym and you want me to go through some of this stuff with you in person, just let me know when you're next in a session, okay? Well, yeah, if you want me to jump on a call with you, whatever, just let me know, reach out to me, drop a comment in this video or message me, and then I'll do my best to help. All right, hopefully this has been helpful for you.